Hi everybody, my name is Dina Peck, and I'm here to talk to everybody about health literacy. We've been talking about health literacy for years, for as long as, quite frankly, I can remember having left college, and I've been very, very passionate about it. But quite frankly, while we've been talking about it, not a lot has been done. We do a lot of talking. But what I believe is that health literacy is a prescription for better patient care and for better patient outcomes. So I want to talk to you about Bob. Bob might be your neighbor, he might be your friend, he might be your grandfather. So Bob goes to his physician, and he's been having horrible ear pain. He goes to his physician, he tells the doctor, you know, my ear, it's really killing me. He gets an exam from his physician, and his physician says, you know what, I'm going to give you some medicine. I'm going to give you these drops in the spray. He says, great. Doctor says, I want you to go home, I want you to use them. And the doctor had noticed he had a little bit of congestion, maybe that was what was causing the ear pain. And so he tells his physician, pardon me, Bob tells his physician once again, you know, is this really going to work? And the physician says, go home. If you're not feeling better in a week, then come back. So Bob goes home. He's really serious. He's going to make sure he does these drops in the spray every single day. He does this, but the pain is getting worse. So a week goes by. He comes back to the physician, and he says, Doc, the pain is getting worse. It's really horrible now. I can barely function. Physician says, well, let me take a look. At this point, he has a full-blown ear infection, also known as otitis media to our physicians, but not what a patient would call it. And he says, I don't understand what's going on. So the patient says, you know, truth be told, it's been hard for me to actually use this medication. I put it in my ear, it drips out. I lay on the couch, you know, and when I get up, it's dripping out. And the physician says to him, well, didn't I tell you it was a nasal spray that I gave you that was going to clear your sinuses and was going to reduce the pain in your ear? Now this happens all the time, except I just gave you a very simple example, but this happens all the time in our medical community. So what I want to talk to you today is, again, about health literacy. It's the ability to understand basic health information to make appropriate healthcare decisions, okay? Again, this is something that we've been talking about for quite some time. Health literacy affects everybody. It affects the young, it affects the old, it doesn't discriminate. People age 65 and older, though, make up nearly twice as many physician office visits per year versus people 45 to 65. Did you know that? Anybody? 2/3 of older people are unable to understand information about their prescription medications. So it's not surprising that when physicians see patients who are on multiple medications, they say, why aren't you compliant? And physicians may think, you know what? These patients, they're lazy. They just don't want to take their medication. And you know what? Sometimes that might be right, but chances are that they don't understand the information that's been given to them. 40 to 80% of the medical information that patients receive, they forget immediately. And 50% of the information they retain is incorrect. I was at the physician's office recently, and I took out my phone, and I started writing information. And he said, are you that obsessed with that thing that we're sitting here trying to have a conversation, in mind you the 3 minutes that he's given me? And I said, no, I'm actually taking notes because I know when I leave here I'm going to forget what the heck you said. But most people don't do that. And most physicians aren't actually giving patients information when they leave the office that are going to help them. So talking about patients with a low level of health literacy, They're less likely to understand their condition. They're less likely to take their medication correctly. And they're less likely to advocate for themselves. And this is something, no matter who we are in the medical community, and I'm going to include myself, who's a professional in medical education or in communication for patients, I'm going to include myself in that. We're not doing enough. We're talking about it. People are publishing articles about it, but people aren't putting it into practice. Physicians aren't putting it into practice. Pharmaceutical companies aren't putting it into practice. Regulators aren't putting it into practice. And communications companies are not doing enough to put it into practice. So what is it that we should be doing? Health literacy is a stronger predictor of a person's health. I'm going to say this again. Health literacy is a stronger predictor of a person's health than age, than income, than employment status, than education level, and race. Shocking. Right? Shocking. 90% of US adults have trouble understanding complex health information. This isn't 90% of people who live in an urban area. This isn't 90% of a specific ethnic community. This is 90% of American adults have a hard time understanding information. So here's what I don't understand. Why is most health information presented in a way that patients still can't understand, despite us knowing that 90% of people find it hard to actually understand any of that information? At our ad agency, what we did was we looked at the top 50 brands, the top 50 pharmaceutical brands, and basically they all have websites. We said, you know what, how many of these sites are health literate so patients can understand them? We know when patients get a prescription, they go online, it's one of the first things that they do, and they go online to find out information about the product. How many of you think we're health literate? 90%? 80%? 20%. 20% were health literate. All I can say to that, I really don't have to say much, right? That's pretty abominable given the fact that we've been talking about health literacy since, at the bare minimum, a lot, since 2000. So, quite frankly, nothing else matters if a patient doesn't understand the information. It doesn't matter whether it's written information, it doesn't matter whether physicians are actually having great conversations and everybody means well. Nobody's saying that anybody wants to fool the patient. But nothing matters if what you say or what you write and what patients actually get, if they don't understand it, it's completely irrelevant. The time that's just been spent with a patient is irrelevant. So how can we put patients first? We need, as a group, as the entire United States, we need to prioritize and finally commit to putting health literacy principles into practice. Not just talking about it, we need to talk about it, but we need to actually do it and make sure that patients understand. You know, we need to talk to them in their language. There's medical speak and there's patient speak, right? When a physician actually, I'm going to trip over this thing and move this out of the way so I don't fall into people's laps. When you go to medical school, you go into medical school knowing what an embolism is? Probably not. There's a lot of language that you don't know when you go to medical school. You go to medical school, you spend about a year in medical school, 2, 3, go on. I don't know what medical school is. But after year 1, all of a sudden, these soon-to-be physicians are actually talking in medical speak. They actually forgot how to speak in real life. They even do it at cocktail parties. You're laughing because you know it's true. So you can sit there and talk at a cocktail party. There are hemodynamic consequences of an acute occlusion of a coronary artery embolus. But when you talk about that to a patient, they hear blah, 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 blah. They don't hear much. So we need to talk to them and use shorter words. We need to write any information down using shorter words. Use complicated. If you don't use complicated, use the word hard. and you might click. Talk to them in plain language. If you're a primary care physician, don't tell them that they're going to go to the cardiologist or that you're recommending they go to the cardiologist. Tell them that you're recommending that they go to the heart doctor. Use shorter sentences. It's sort of hard to see up here, but you don't have to say there are special rules for what you can eat or drink before your treatment takes place, so there's no need to plan special meals around your treatment. You can just say there are no special rules about eating or drinking before your treatment. It's very, very quick. Very, very easy. Let's try not to complicate things. You should also use shorter paragraphs. So if we're going to publish anything, if we're going to give them any information when they're going to leave your office, and again, this goes to pharmaceutical companies and everybody out there that's giving information, shorter paragraphs actually tell a longer, better story for patients. Also using shortcuts through imagery. If a medication can be taken for a woman who's pregnant, just show her a picture. You don't have to go through giving lots and lots of information. Now there are medication guides for products that are out there. And this is usually what they look like. Pretty horrible. I can't even understand what it says. But if we actually brought in some of these principles, this is what it could look like. And guess what? It's clear as day to understand. Teach-backs are critical. We're not doing enough to teach physicians about teach-backs. That means I have all of this information I want to tell you. I'm going to tell it to you in a short little bit, 30 seconds, and I'm going to have you teach it back to me. I'm not going to talk to you for 3 or 4 minutes and then say, did you understand that? Because if a patient doesn't understand that, guess what they're going to tell you? Yup, I understood it. Thank you, doctor. Then they're going to leave, not be compliant, not understand what you actually told them. So health literacy isn't only about words, pictures, and conversations, it's also about accessibility. And I have a short story for you about, we started working in the category of arthritis. And so doing my own due diligence, ordered a lot of information about materials that were out there for patients with arthritis. And one of the things I'll never forget, I got this beautiful box. And I opened it up. It was actually hard for me to open up, and it had this little button with a thread to close it once I put all the materials back in. And I was like, wow, this is really hard for me to deal with. Well, 90% of people who have arthritis have it in their hands. You getting my point? Do you think that piece was very accessible? No. But it made an art director really proud to do a piece that was gorgeous. Not good health literacy. We worked in the category of macular degeneration. We did the exact same thing. We looked at all the pieces in the world of macular degeneration, and guess what we found? These are people who are going blind, by the way. Okay? They're older, they can't really see, and everything that was out there was in 11 and 12 point type. Like they can't see, right? I can barely see 11 and 12 point type. So everything that we did in 16-point type. And what did it do? It helped people retain the information, it helped people see the information, first of all, and we ended up having great results. So what am I talking about? Being quick, being simple, being concise, having nice, clear imagery, being smart, and summarizing information, whether it's paragraphs that you're handing out, or whether it's actually just a conversation. Summarizing is very, very important. Here's what we do know. We know in the world of the web, we know that for people who get emails, if the content from you, again, whether it's a pharmaceutical company sending it out, whether it's a physician sending it out, if the content is health literacy, if the subject line is health literate, they're 20% more likely to open up that email. We know that they're 60% more likely to spend time on your site. It's amazing, right? And we know that they're 3 times more likely to go to information on a site to learn about how to talk with their physician about their condition. And so that information leads to conversations. Here's what else we know. Health literacy equals improved understanding. Health literacy equals improved compliance. Health literacy equals improved outcomes. And health literacy is the prescription for better patient care and better patient outcomes. Thank you.
Thank you very much to Dina Peck.